In this video, learn how to cleanse your liver and blood vessels in 5 easy steps with 10 incredible foods. Also, discover the symptoms, causes, and treatments of liver and blood vessel problems. The liver and blood vessels are vital organs that perform many functions, such as filtering the blood, producing bile, and metabolizing nutrients. However, they can also be affected by various diseases and disorders, such as cirrhosis, portal hypertension, and liver hemangioma, which can cause serious complications and impair their functions. Some of the common symptoms of liver and blood vessel problems are skin and eyes that appear yellowish, jaundice, which indicates a buildup of a substance called bilirubin in the blood due to liver damage. Bilirubin is a waste product that is formed when red blood cells break down. Normally, the liver filters out bilirubin from the blood and excretes it into bile, which is then stored in the gallbladder and released into the small intestine to help digest fats. However, when the liver is damaged or inflamed, it cannot process bilirubin properly, and it accumulates in the blood and tissues, causing the skin and eyes to turn yellow. Abdominal pain and swelling, which may be caused by fluid accumulation in the abdomen, ascites, or pressure on the liver from enlarged blood vessels, varices. Ascites is a condition where excess fluid builds up in the space between the organs and the abdominal wall due to increased pressure in the portal vein, which carries blood from the digestive organs to the liver. Portal hypertension can result from liver scarring, cirrhosis, blood clots, or tumors that block the flow of blood through the liver. As the pressure rises, fluid leaks out of the blood vessels and into the abdominal cavity, causing distension, discomfort, and difficulty breathing. Varices are enlarged and twisted veins that develop in the esophagus, stomach, or rectum due to portal hypertension. They are prone to bleeding, which can be life-threatening. Swelling in the legs, feet, or ankles, edema, which may result from low levels of a protein called albumin in the blood due to liver dysfunction. Albumin is a protein that is produced by the liver and helps maintain the balance of fluid and pressure in the blood vessels. When the liver is damaged, it cannot produce enough albumin, and the fluid leaks out of the blood vessels and into the tissues, causing edema. Edema can also be caused by other factors, such as heart failure, kidney disease, or malnutrition. Itchy skin, pruritus, which may be caused by bile salts accumulating in the skin due to reduced bile flow from the liver. Bile is a fluid that is produced by the liver and stored in the gallbladder, and helps digest fats and eliminate toxins from the body. When the bile ducts are blocked or narrowed, bile cannot flow into the intestine and backs up into the liver and blood. Bile salts, which are components of bile, can irritate the skin and cause itching. Dark urine color and pale stool color, which may indicate a blockage of the bile ducts or a reduced production of bile by the liver. Bile gives urine and stool their normal color. When bile is not excreted properly, urine becomes dark and stool becomes pale or clay-colored. This can also affect the absorption of fat-soluble vitamins, such as A, D, E, and K, and cause deficiencies. Chronic fatigue, nausea, vomiting, and loss of appetite, which may reflect the impaired metabolism and detoxification functions of the liver. The liver plays a vital role in converting food into energy, storing glycogen and vitamins, and breaking down toxins and drugs. When the liver is damaged, it cannot perform these functions efficiently, and the body becomes weak, tired, and sick. Nausea, vomiting, and loss of appetite can also be caused by the accumulation of toxins in the blood or by the inflammation or infection of the liver. Tendency to bruise easily, which may result from a decreased production of clotting factors by the liver or an increased breakdown of blood cells due to portal hypertension. Clotting factors are proteins that are produced by the liver and help the blood to clot and stop bleeding. When the liver is damaged, it cannot produce enough clotting factors, and the blood becomes thin and prone to bleeding. Portal hypertension can also cause the spleen to enlarge and trap more blood cells, reducing their number and lifespan in the circulation. Weight loss and muscle loss, which may occur due to malnutrition, malabsorption, or increased energy expenditure by the liver. Malnutrition can result from a poor appetite, nausea, vomiting, or dietary restrictions due to liver disease. Malabsorption can result from a reduced production or flow of bile, which affects the digestion and absorption of fats and fat-soluble vitamins. Increased energy expenditure can result from the increased work that the liver has to do to cope with the damage and inflammation, or from the increased breakdown of proteins and fats to provide energy. Musty-smelling breath, fater hepaticus, which may be caused by the accumulation of volatile substances in the blood that are normally metabolized by the liver. One of these substances is dimethyl sulfide, which has a characteristic rotten egg smell. Dimethyl sulfide is produced by bacteria in the gut and is normally removed by the liver. However, when the liver is damaged or the portal vein is bypassed, dimethyl sulfide can enter the systemic circulation and reach the lungs, where it is exhaled. Mild brain impairment, hepatic encephalopathy, which may be caused by the accumulation of ammonia and other toxins in the brain that are normally cleared by the liver. Ammonia is a waste product that is formed when proteins are broken down by bacteria in the gut. Normally, ammonia is converted into urea by the liver and excreted by the kidneys. However, when the liver is damaged or the portal vein is bypassed, ammonia can enter the systemic circulation and cross the blood-brain barrier, where it interferes with the function of nerve cells. This can cause confusion, mood changes, memory loss, sleep disturbances, and impaired coordination. Cleanse your liver and blood vessels in 5 easy steps with 10 incredible foods. Step 1. Drink plenty of water. Water is essential for flushing out toxins and waste from your blood and organs. Aim for at least 8 glasses of water a day or more if you exercise or sweat a lot. Water also helps to keep your blood vessels hydrated and flexible, preventing them from narrowing and hardening. Step 2. Eat more fruits and vegetables. Fruits and vegetables are rich in antioxidants, vitamins, minerals, and fiber that can help protect your liver and blood vessels from damage and inflammation. Some of the best fruits and vegetables for cleansing your blood are berries, such as blueberries, raspberries, strawberries, and cranberries. They contain anthocyanins, flavonoids, and vitamin C, which can help lower blood pressure, cholesterol, and inflammation. Cruciferous vegetables, such as broccoli, cauliflower, cabbage, kale, and Brussels sprouts. They contain glucosinolates, sulforaphane, and indole-3 carbinol, which can help activate liver enzymes, reduce oxidative stress, and prevent cancer. Beets, carrots, and spinach. They contain betalains, carotenoids, and chlorophyll, which can help increase blood flow, oxygen delivery, and detoxification. Step 3. Add some herbs and spices to your diet. Herbs and spices can add flavor and health benefits to your meals. Some of the best herbs and spices for cleansing your blood are turmeric, ginger, and garlic. They contain curcumin, gingerol, and allicin, which can help reduce inflammation, improve blood circulation, and protect the liver from toxins. Dandelion, milk thistle, and nettle. They contain taraxacin, silymarin, and quercetin, which can help stimulate bile production, support liver function, and act as diuretics. Cinnamon, cloves, and cardamom. They contain cinnamaldehyde, eugenol, and limonene, which can help lower blood sugar, cholesterol, and blood pressure. Step 4. Avoid or limit alcohol, caffeine, and processed foods. Alcohol, caffeine, and processed foods can put extra strain on your liver and blood vessels, as they contain toxins, additives, and preservatives that can interfere with your body's natural detox process. Alcohol can also dehydrate your body and damage your liver cells. Try to limit your intake of these substances, or avoid them altogether if you can. Step 5. Exercise regularly and manage your stress. Exercise can help improve your blood circulation, oxygen delivery, and metabolism, as well as boost your mood and immune system. Aim for at least 30 minutes of moderate physical activity a day, or more if you can. Stress can also affect your blood pressure, heart rate, and hormone levels, as well as increase inflammation and oxidative stress. Try to find healthy ways to cope with stress, such as meditation, yoga, breathing exercises, or hobbies. Some possible treatments are medications to reverse poisoning. Some liver problems are caused by an overdose of certain drugs, such as acetaminophen, or by exposure to toxins, such as mushrooms. These cases may be treated with medications that can neutralize the effects of the poison and reduce liver damage. For example, acetylcysteine is a medication that can treat acetaminophen overdose by replenishing the levels of glutathione, a natural antioxidant that protects the liver cells from the toxic metabolites of acetaminophen. Acetylcysteine can be given orally or intravenously, depending on the severity of the poisoning. Medications to reduce pressure in the portal vein. The portal vein is a large blood vessel that carries blood from the digestive organs to the liver. When the portal vein is blocked or narrowed by a blood clot or a tumor, it can cause portal hypertension, which is high blood pressure in the portal vein. This can lead to complications such as bleeding in the esophagus or fluid accumulation in the abdomen. Some drugs, such as beta blockers, nitrates, and octreotide, can lower the pressure in the portal vein and prevent or stop bleeding. Beta blockers work by reducing the heart rate and the force of contraction, which lowers the blood pressure in the portal vein. Nitrates work by dilating the blood vessels, which reduces the resistance to blood flow and lowers the blood pressure in the portal vein. Octreotide works by inhibiting the release of hormones that increase blood flow to the digestive organs, which reduces the blood volume and pressure in the portal vein. Liver transplant. When the liver is severely damaged or scarred by diseases, such as cirrhosis or acute liver failure, it may not be able to perform its vital functions, such as filtering the blood, producing bile, and metabolizing nutrients. In these cases, the only treatment may be a liver transplant, which is a surgical procedure that involves removing the diseased liver and replacing it with a healthy one from a donor. A liver transplant can improve the quality and length of life of patients with end-stage liver disease, but it also carries some risks, such as rejection infection, bleeding, and complications from the surgery or the immunosuppressive drugs. Therefore, a liver transplant is only considered when other treatments have failed or are not available, and when the patient meets certain criteria, such as having a good prognosis, a compatible donor, and no other serious medical conditions. Thank you for joining us. Your health is of utmost importance, and taking care of your liver and blood vessels can significantly impact your overall well-being. If you found this information helpful, please give us a thumbs up, share the video with your friends, and subscribe for more valuable insights on health and wellness. Take charge of your well-being, and stay tuned for more tips on living a healthier, happier life.